Let me explain something about muscle pain that most office workers don't understand. Those knots in your neck and shoulders aren't just tight muscles that need stretching. They're likely myofascial trigger points, which are hyperirritable spots in muscle that create very specific referred pain patterns, and they require specific treatment that goes beyond what most people think of as muscle pain management. The physiology here is fascinating. When a muscle sustains a contraction for long periods, which happens constantly with poor office posture, you get local ischemia. That means reduced blood flow to that area. Metabolic waste products accumulate, and you get these tender knots forming in the muscle tissue. What makes trigger points particularly tricky is the referred pain phenomenon. An active trigger point in your upper trapezius muscle in your shoulder can cause headaches, jaw pain, or arm symptoms. The pain isn't where the problem is, and that confuses both patients and sometimes healthcare providers. You can learn to assess these yourself. Common trigger point locations for office workers are the upper trapezius, the levator scapulae, and the suboccipital muscles at the base of your skull. When you press on an active trigger point, you get that familiar pain referral pattern, and often the person recognizes it as their typical pain. This is actually a diagnostic sign. The treatment hierarchy is important. First, you need to identify and eliminate perpetuating factors. If your posture is terrible, if you're chronically stressed, if you have nutritional deficiencies, particularly magnesium and vitamin D, those perpetuate trigger points. Then you need to actually release the trigger points through techniques like ischemic compression, where you apply sustained pressure or dry needling, or in some cases trigger point injections. But then, and this is crucial, you have to address the underlying movement dysfunction that created them in the first place. Self-treatment is possible for some trigger points. A tennis ball or lacrosse ball against a wall can work for some areas. A Theracane tool helps you reach areas like between your shoulder blades. But some trigger points, particularly deep ones or ones in hard-to-reach locations, really need professional treatment. Here's what concerns me about long-standing trigger points. Over time, they create neuroplastic changes. The nervous system gets involved, and the trigger points become harder and harder to eliminate completely. This is why early intervention matters so much. A trigger point that's been there for 6 months is much easier to treat than one that's been there for 6 years. The other problem I see is symptom-only treatment. People get massage, which feels good and provides temporary relief, but if you're not addressing why the trigger points formed, you're just recreating them. Heat helps temporarily, ice helps temporarily, but without correcting the posture or ergonomics that caused the sustained muscle contraction in the first place, you're on this treatment treadmill where you get relief, and then the trigger points come back. The combination approach is what works. Release the trigger points, correct the ergonomics, address any psychological stress that's contributing to muscle tension, and retrain movement patterns. But that comprehensive approach requires more than the typical 15-minute doctor's appointment or even standard physical therapy protocols. It requires understanding trigger points as a distinct entity, not just general muscle tightness.